Well, February we know is American Heart Month and a good opportunity to talk about congenital heart defects, something that some babies are born with.
A program at Rocky Mountain Hospital for Children follows young patients into adulthood. And our Jamie Leary talked to one patient who, after more than 40 years of monitoring, no longer has to worry.
The woman we met was born with a congenital heart defect. She was seen here as a child, and thanks to a program that follows the condition into adulthood, she was able to return here last week to the pediatric unit for her final open heart surgery.
A lot of them are the patients that we operated on early on in life who now may need a 50,000-mile checkup.
Miranda Brown never came back for her 50,000-mile checkup, but her heart let her know it was time.
I constantly had chest pain. I would lose my color, turn gray.
Born with a congenital heart defect, she spent a lot of time as a kid at Rocky Mountain Hospital for Children. Now 46, she found herself right back in the pediatric unit in need of surgery.
It was great to see Dr. Washington again. Yes, he was my pediatric cardiologist. Was with him until I was in my 20s. And when I was in my 20s, he's like, okay, it's about time you go find an adult cardiologist.
It's how she eventually met Dr. Emmanuel Turner, the new chief of cardiology here. As a congenital heart surgeon,
We're trained to be able to take care of neonates, infants, all the way up.
he may not have been her surgeon as an infant, but he knew how to treat her as an adult. In the pediatric unit, Brow received a new pulmonary valve, and 4 days later, she was out. This will likely be her last open heart surgery.
I had no idea that they have this new technology that can give me a new lease on my life and feel better. And when you find a surgeon like that, you want people to know that he's here.
I'm Jamie Leary, covering Colorado First.
It wasn't a typical day in the classroom for some students in Wheat Ridge.
Yeah, they got a chance to talk